Hi everyone, my name is Dr. Monica Bonakdar. My practice, Bonakdar Aesthetics, is located in Newport Beach, California, and it is focused entirely on aesthetic medicine and making your face and body beautiful. Today we're going to be discussing CoolPeel, an exciting new treatment that we are adding, and it's a skin resurfacing treatment to make your skin beautiful, maximal results, minimal discomfort and downtime. CoolPeel, by targeting the superficial layer of the skin, removes the damaged skin cells, revealing beautiful, healthy skin. This treatment can be done with no numbing cream. However, I prefer to numb all my patients, and you'll see with our patients that they're both very comfortable and they're not flinching. This treatment is not disruptive to your lifestyle. You can do the treatment and go on with what you have planned in your life. Day one, you are a little bit pink and swollen as if you have a mild sunburn. Day two, you start to get a little browning of your skin, and by day three, the pink and the swelling has subsided and the brown just kind of scales off. This is a picture of my beautiful friend, Emily Frost, who is a nurse in Arizona, and you can see that right after the treatment, she was pink. Day one, she was pink. Day two, you can kind of see a little bit of brown coming to surface, and by day 4 and 5, she has a glow, and she is getting compliments. When I had my treatment, I pretty much had the same experience. I did notice that all my downtime was pretty much gone by about the third day, and even on day 1 and 2, I just wore a tinted sunscreen and went to work. It's been about 3 weeks since my very first treatment, and my pores have not been so tight and small since I was in my 30s. So I'm loving my results. Once in a blue moon in aesthetic medicine comes along a new technology that completely disrupts the space and makes all sorts of possibilities that we didn't have before available. And I truly believe that CoolPeel treatments are one of these disruptor type of technologies that has come around. Let me take you through the history of laser resurfacing. In the 90s, we had CO2 laser resurfacing, and the results were amazing. However, the treatment was very painful. You needed to be under general anesthesia to have one, and the downtime was very protracted, with your pinkness, redness continuing for up to 2 months sometimes, and there were high risk of complications. And by complications, I mean hyperpigmentation, hypopigmentation, line of demarcation of where the laser treatment stopped, and risk of infection. Then we didn't really have anything that was new until about the early 2000s, where fractional laser resurfacing was introduced. That could be done under local or topical anesthesia, and that reduced the downtime for the patient to about a week. It wasn't a CO2 result, but for what it was, great treatment. Then came fractional CO2 laser resurfacing with UltraPulse FX, which I like to call CO2 2.0. and that reduced CO2 downtime from like a month to 2 months to 2 weeks. And it could be also done with local anesthesia, topical anesthesia. Incidentally, I was one of the first physicians in Newport Beach to own Fraxel and also UltraPulse FX. And then through the 2000s, we really didn't have anything until for resurfacing until 2016, where the first fractional microneedling radiofrequency device, Vivace, was FDA cleared. And Vivace remains one of my absolute favorite treatments. And I will tell you how I actually combine Vivace treatments with CoolPeel treatments. And then just recently, CoolPeel is our last game changer that I'm very excited about. I've always been on the cutting edge of being an early adopter in this space, and CoolPeel is the new addition to my practice because it fits what it is that I'm looking for. Better patient experience, great results, no social downtime. The manufacturers of this treatment manipulated the CO2 2.0 and arrived at this, what I call CO2 3.0. They manipulated the power and how the pulse is delivered so that you get the results without the thermal damage to the skin that causes the downtime. And that's why it's actually called the CoolPeel, because it is that lack of heat that reduces the downtime.